This is Fawn from NC Child. We're going to get started with the County Data Card webinar in just a moment. Thanks so much for joining us. We just have a couple more people joining. Hey everybody, thanks so much for being here. This is Fawn Pattison at NC Child. I want to thank you all for joining us today for this webinar to release our 2020 County Data Cards. We're really excited to have you here with us today. NC Child is a nonprofit organization based in Raleigh, North Carolina, and our mission is to promote policies that allow every child in North Carolina to thrive. And to do that, we base much of our work on good data about what kids and families are experiencing across the state. So this annual release really gives us a snapshot of some key indicators for kids and families across the state. Just before we get started, I have a little bit of housekeeping. Everybody is on mute right now. Whitney is going to give a presentation. It will probably take about 20 minutes. And then if you have questions, first, we'll take questions from any members of the press. Just unmute yourself to ask your question. You're welcome to turn on your video, but of course you don't have to. But we're always happy to see your faces, y'all. And then once press questions are finished, then we're also able to take questions from any of our Child Advocacy Network members or other folks who are on the call or video. I keep saying call as if it's 1997, but y'all, it's 2020, and here we are at the County Data Card release. So thanks again for being here. One thing I really do want to stress is that the data points for these data cards were all collected before the pandemic began. So we think this is a really important jumping off point for those of us who serve kids and families, for those who are elected officials, public officials, to have really clear benchmarks for where families were before this pandemic started so that we understand what we need to be tracking as we go forward. So I think this whole presentation, webinar, Q&A will probably take about 30 minutes. We are recording it and we'll send out the recording afterwards. Again, after Whitney's presentation, we'll take questions, press first, and then anyone else, just unmute yourself to ask a question. And with that, I would love to introduce my coworker, our acting policy director at NC Child, Whitney Tucker. And Whitney's going to present the county data cards. Thanks, Whit.
Thanks for teeing that up, Fawn. So I figured that we should start today with just a quick overview of the demographics in regard to children across the state. And so, Fawn, if you could get the slide deck up, please. I want everyone to be able to see a quick pie chart that I've made that breaks this out by race, because you're not going to see that on the county cards, but it was really just a matter of space, nothing else. Overall, we have over 2 million children in North Carolina, about 2,300,000, and nearly 1 in 3 of those children is under the age of 6. So we're gonna, sorry here, quick technical issue, guys. Let me share my screen with you and get them up on my side. Sorry. Is everyone able to see? What about now? Good to go?
Looks good, Whitney. Thank you.
All right. So as you can see here, the majority of the children in our state are white, but the second largest demographic group of children are Black children, followed by Hispanic and Latinx children, and then children of another race. This is relevant because as we go through these slides, I'm going to talk about the indicators where you might see a sharp decline or increase in your particular county of interest compared to the state. And a lot of the time that interest is driven by a racial disparity. And so it's relevant for you to think about the demographics of your specific area as we go through and talk about each of these individual points of interest. Sorry, it doesn't look like I can check the chat without throwing you guys off here, so sorry about that. So food security, this is an indicator that we're going to look up right now, obviously in light of COVID-19. 1 in 5 children statewide are food insecure, but this really varies a lot from county to county. On the next slide, I'm going to show the top 5 and lowest 5 counties in terms of food insecurity. But for you to understand that indicator, I just wanted to put in a quick definition here. The simplest way to define this is consistent access to enough food for all household members to live a healthy, active life. That means a lot of different things, but the USDA has actually created definitions for a healthy life, for an active life, for enough food, right? And they actually create this indicator and put out a survey where we get these results. And so they're available at the county level. And when you look at that level, you see that our highest rates of food insecurity in the state tend to be in Eastern North Carolina, and then the lowest rates of food insecurity, not. But we do see that urban centers tend to have more access, even if food might not be higher quality. That's a general trend that follows nationwide as well. And so a lot of the time people might live closer to a food bank or something like that, right? So that's something to consider right now. And also the fact that because so many parents have lost their jobs and their sources of income, that we do expect this indicator to get worse across the board, not just in the places that were already really struggling with food insecurity. Closely related to that, of course, is poverty. At North Carolina Child, we actually measure children who are living in poor and low-income homes rather than just poverty itself. Poverty is 100% of the federal poverty level, whereas children who live in poor and low-income homes, we're looking at kids who are living at 200% of the federal poverty level. At the last check, nearly half of North Carolina's children lived in those homes before COVID-19 even struck. Children who are most at risk of living in poor and low-income homes are Black and Latinx children, children under age 6, and children in rural counties. We know that, again, because of job losses and how many parents are now struggling to meet these needs, that any closures of plants, restaurants, places where a lot of people in your communities, whether they be big or small, might have been employing parents, are going to drastically change this particular indicator. On the slide, I've put the counties that have the highest rates of children in poor and low-income homes, and also those that have the lowest rates. The reason that we see the 3 groups that I've listed here at particularly high risk are because, for one thing, with Black and Latinx children, we're looking at years of historical barriers to family economic mobility that were put in place due to racist policy that really has just been continued over time, that makes those parents less likely to receive the education that leads to high income wages, less likely to actually be employed, even when they are eligible for those jobs, when they have the training. We also know that they're more likely to be relegated to certain neighborhoods of low opportunity, and that continues today, right? We also know that children under age 6 are most likely to live in poverty because they are more likely to be born to young parents who are less financially established than older parents. And then also we see that children in rural counties are more likely to live in poverty than children in urban counties, and that's because they tend to lack access to a lot of the things that we consider basic needs for families. Now, moving on to health insurance, this is another really big driver in our state of a lot of hardship right now. It's obviously relevant to family economic stability because high medical bills can really stop a family from being able to save, but also it's really relevant to public health at this point. More than 130,000 children in North Carolina have no health coverage at all. There has been a lot of research that's been done that shows that this is highly influenced by parental health coverage. So when parents are insured, children are more likely to be insured and to receive regular health care. When parents aren't, the opposite is true, right? Uninsured children have fewer well-child visits and vaccinations, which is a problem because it means that we're going to see more children in counties that have high rates of child uninsurance, that aren't getting developmental screenings, that aren't getting their routine vaccinations. And we also know that this number is likely to continue climbing as we go through the pandemic because people are, afraid to visit their doctor's offices and also unable to afford it. Right? And so can you imagine just a second wave of COVID-19 hitting in the fall and also an outbreak of measles, right? It's really important that families feel that they can afford to take their kid in for care. And without access to affordable health coverage, that's just not going to be the case. We know that a lot of people got their health coverage through their jobs that they no longer have. Late prenatal care and poor birth outcomes are also linked to a lack of coverage. And I'm going to go through that on the next slide. But before we move on, I just want to point out that all of the counties that are listed here are those with the 10 highest rates of children without health coverage. So places where the most children have no health coverage at all. Right. And so just noting again that our statewide average is 5%, and that we had seen a steady decline in that figure until really recently. And that also mirrors national trends. But even then, we see North Carolina overall at 5%, whereas Graham County is up around 19%. And so you want to think about what might be happening at your county level that could influence that. Have there been hospital closures? Have there been a lot of layoffs, pre-COVID that were causing parents to not be able to afford coverage and thus be less likely to take their kids in for care? There are a lot of things that could influence this, but it's worth digging into, especially in these counties where we're seeing, double the statewide rate. Now, moving on to birth outcomes. So as I mentioned, having health insurance is a big predictor of whether or not women who give birth are very likely to have children who are born full term, whether they're likely to have children who are born at a healthy birth weight. And we know that in North Carolina, race is also a really important factor here. Pre-COVID, nearly 7 infants per 1,000 died before their first birthday in North Carolina, which is terrible. But unfortunately, it is good news for the state compared to where we were before. We've actually recently reached our lowest infant mortality rates in decades with a 6.8 per 1,000 infant mortality rate for the state, right? And that is, I guess it depends on how you look at it, right? But even then, we see that our overall mortality rate is at 6.8, whereas for white infants, that mortality rate is 5.5, and for Black infants, we're looking at 12.2. Right? And so there is something different that is happening in the way that we are treating Black mothers and Black infants that is leading to higher death rates across the state. And it's not only health insurance, but that is a factor. I've listed here the counties that have the highest rates of infant mortality and then those that have the lowest rates of infant mortality. You'll note that on that side with the lowest rates, that 14 counties had an infant mortality rate of 0 in our data year for this year's county cards. That means that no infants died in that particular year, but you can see a lot of change in this particular indicator from one year to the next, right? So you want to note that with a rate, a county size is really going to influence this a lot. In a small county, if you have 5 children who die compared to a larger county, that's going to lead to a higher rate, right? And so that is something that you need to take into account. But I have looked into a few of the counties here, and what I did see is that a lot of the time the overall infant death rate was pretty high, mostly because there was a really significant racial disparity. So while the death rate for white infants might be relatively low, for Black infants and also in some cases for Hispanic infants, it was often 2 or 3 times higher. And now finally, early education was something that we wanted to lift up right now because it is especially relevant in light of COVID. We know that the reduced access to childcare that's going on currently is really likely to impact future 3rd grade reading scores. Statewide, there was a slight uptick to 57% of students who scored proficient in 3rd grade reading in our latest data year, which is 2018-19. And that is unfortunately good news, right? It's still way too many students who are not scoring proficient in reading, but we know that that is influenced by many factors, and a big one is access to high quality early education. There are a multitude of studies that point to lots of improved K-12 outcomes when you are able to attend a early care that is affordable for your family, so you can stay in that care from the time that you are 3 years old to 5 years old, preferably, but at least starting at age 4. And then also that you are more likely to do better in 3rd grade reading as well as 8th grade math. But particularly the 3rd grade reading scores have a strong correlation to that access, right? Right now, we know that half of childcare centers in the state have already closed due to COVID-19. And because they operate on really tight margins, they're very unlikely to be able to open back up unless policymakers infuse some additional money into that system. They just cannot carry the losses that they've sustained and be able to keep on their trained staff that keeps that quality level up, right? And so I've listed here on the slide all the counties that have the highest proficiency rates across the state, and then also those with the lowest. And so you see that it's a very wide range, going from 37% to 82%, right? And so there are areas of the state where kids are getting a vastly different level of education and access that is affecting these 3rd grade reading scores, because we know that every child, when given the right conditions and the opportunity, can thrive, right? And so there's something going on with reading proficiency that is impacting scores in the lower performing counties and also in the higher performing counties. And we need to look into that more to figure out what's working and if it's replicable. And one of the things that we know could help is opening up childcare centers in a way that is safe and sustainable. And so we need to be looking at how to fund providers so that they keep their quality trained staff, and then also how to ease the cost burden on parents so that they can afford high quality care. Some additional things that I really wanted to lift up in this year's release are that children's behavioral health is going to be very important to monitor moving forward. We don't have indicators on that in the county data card, but I do want to make sure that you guys are thinking about that as you work on any stories, if you're a reporter or if you're someone who works closely with families at the county level, to consider the fact that there is reduced social support for children right now because there's no school-based learning, there's no after-school care, there aren't any extracurricular sports, right? They're not seeing a lot of their friends the way that they would have before, and that can have an impact on them, behaviorally. And then also that there is just generally reduced access to mental and behavioral health care. Even those that are being offered via telehealth, we know that there isn't equal broadband access across the state, right? So all kids aren't actually able to access even what is available at the same rate. And then also that some kids do need that in-person interaction that really keeps them on track, right? Also, there's the fact that household stressors can really impact children, right? And so parents are under incredible amount of stress right now. Most have lost, or many have lost their jobs. A lot of them also are suffering just from the mental stress of staying inside, right? And there's a lot of trauma that comes through living with a pandemic that kids are going to be living out in future data years, and we're going to be able to see that in mental and behavioral health indicators that will come out in other sources. So that's something to keep a pulse on. Also related to household trauma is the fact that that after recessions and economic depression, that rates of child abuse and neglect tend to go up. But during those recessions, we see that there is less reporting, right? Right now, we're seeing a lot less. We've actually gotten reports at NC Child already that there have been pretty significant drops in the reports of child abuse and neglect because fewer mandated reporters are actually seeing children right now. So because parents aren't able to afford it or they don't feel it's safe, they're not seeing their doctors on time. Kids aren't going to school, so teachers aren't being able to interact with them. And the fewer people that have eyes on children that might be at risk for child abuse and neglect, the lower we're going to see those reports come in, but that doesn't necessarily mean that children are safer right now. And so something to keep an eye on will be reports of abuse and neglect over time, and then also substantiations. We unfortunately do expect those to rise as well. So on the bright side, some policy solutions, right? Things that NC Child thinks could be really helpful to combat one of these issues. The first is extremely obvious, and you've probably heard a lot about it lately, but expand Medicaid, right? We know that North Carolina is now one of only 14 states that have not expanded Medicaid, and it is hurting people economically, but also from a public health perspective, because they aren't able to afford the care that they may need to identify the fact that they have COVID-19, to deal with the symptoms of COVID-19. There are just a lot of impacts, even outside of that, right? Things like the birth outcomes that we talked about that we're going to see for years to come, because women who are of childbearing age actually need healthcare even before they become pregnant in order to have those good birth outcomes, right? And so all of those things kind of intertwine into this one issue of Medicaid expansion, and it could really help on so many different fronts. Health coverage improves family financial stability, and it increases the likelihood of those well-child and immunization visits as well that we talked about, right? The second thing that we can do is really expand and extend the programs that we know are working. Poverty and hunger fighting programs like SNAP, like WIC, like TANF, and please put in the chat if these acronyms are getting to be too much and you do not remember what these things are. That's completely fine. But we can talk through each of those programs. But all of those have had emergency benefits made available to families right now through the pandemic. And what we need to see is that those last through recovery, right? We know that COVID has sharply increased need across the state, and that more families are now relying on mobile feeding sites to make sure that they are able to have healthy, nutritious meals that are available regularly to children. And so we want to be sure that even after the emergency period has ended and families aren't at this, immediate risk of COVID exposure, that while there is still this economic uncertainty and a lot of people are still unemployed and unable to afford food, that they are able to keep access to these programs. They get them food and also cash assistance that they need to keep the lights on, to keep the homes running, to keep kids in stable environments. And then finally, invest in the early education sector. As I mentioned, just reduced access to early education across the state is going to impact school performance, and it's also going to impact parents' ability to go back to work. If we see that more of the providers that have already closed their doors are not able to open them back up financially, like that they cannot afford to do that, what's going to happen is that eventually the emergency period will end. Eventually parents will get jobs again. They will go back to work, and they will want to, but they won't be able to, because there won't be anywhere to put those children during the day where they can get that enriching environment and learn the things that they need to get them on track for their grade reading skills. Right? And so a lot more parents are going to elect to stay home. And there's also research around that when parents do need to elect to stay home, that we often see women are the ones who tend to do that. And so there are going to be equity impacts from that down the road as well, if we aren't able to invest in our early education sector today. Things like hazard pay, money for sanitation in childcare centers, which we know is a big deal because little kids love to wipe their noses on their arms. Things like that are very important right now, and they keep our centers open, and they keep those high quality teachers that get kids to that place they need to be with their grade reading, staying in those centers, continuing to work, and they make it in their best interest to do that. Because obviously they have families as well, and we want to be sure that it makes sense for providers to keep providing that care. So are there any questions about that data?
And just as a reminder, we're going to take questions first from any members of the press. So just please unmute yourself and go ahead and ask a question. Not hearing any questions coming through. I know we still have a few reporters on the call, so if anybody wants to jump in with a question, this is the time.
Hi, my name is Ross Kiefer. I'm with the Statesville Record and Landmark.
Hey, Ross.
Nice to be here. Just one of the questions I have, and I guess this may be a little bit outside of the presentation, but I was just wondering, as states and local governments kind of report losses in tax revenue and income due to the just overall shutdown, how is that going to, I guess, necessarily impact just the ability to identify people in need, and B, the resources that people can access at a local level.
So you're saying how will local revenue losses impact the ability to identify who is at need?
Yeah, for, I guess, like local, state and local governments.
Sure. So I do think that it's going to make it more difficult, right? I think that we're already seeing that there's going to be some proxy indicators that are going to pop up that are going to show you who's at need, right? Like, so mobile feeding sites will have more people requesting meals than they can actually serve, right? We're going to see that without there being some more state and local infrastructure in place, that more people are going to be using things like, local libraries to apply for benefits, things like that. But we also know that a reduced tax revenue is going to put a squeeze first on social services, right? That those are often the first things to be cut because other things are considered, more essential. And so more families are likely going to be falling into these categories and unable to access any of the benefits that are available to them because they just aren't aware of them because they weren't, eligible for them before this pandemic hit, and need to be educated more about that. And there's not going to be any indicator of, how many people that's really happening to at the time. And so I think that's why proactive engagement right now from policymakers is so important. We need to try and clear up any potential revenue shortfalls by using the money that was allocated to North Carolina through the CARES Act right now as much as we can to try and keep that from ever happening, because eventually there are going to be people who are going to fall through the cracks and we won't be able to find them.
Cool.
Thanks for that question, Ross. Do we have any other questions from the press?
Hi, this is Liz Bell with Education in C.
Hey,
I'm wondering
Liz.
if there's any, hey, thanks for doing this, y'all. I'm wondering if there are any parts of either the statewide measures or the county-specific measures that show either improvement or drops in these measures compared to previous data cards that y'all have put out? Or do you recommend kind of comparing these measures to past years?
Sure. So we definitely recommend comparing the measures to past years. The data card is really set up for that. There's only one indicator that you won't be able to do that with. And I think that it was children in foster care. I can't remember what the specific wording of the indicator was, but we did remove that indicator and replace it this year and for years moving forward because of some issues pulling that data from NCFAS, because we want it to be possible for folks to be able to compare years, right? And so some of the things that got better, we did see that uptick in students who were scoring proficient in reading. It was really slight. I think it was 56% to 57%, right? So I mean, not too significant, but it was an improvement, right? And all improvement is relatively important. So that was something. We did see a historic drop in infant mortality statewide, right? So 6.8 is still way too many children dying every year, but we do know that that is the lowest that North Carolina has reached in decades for infant mortality across the state, even though there is still that insanely large racial divide there. I think that there are bright spots, but it really depends on how you frame things, right? So, for example, with infant mortality, that is positive news, but it is not positive for the Black families in the state who are more than twice as likely to have their children die before their first birthday. So it depends. But also when you look at the county cards, each of the squares on the cards shows a data year under it. And then it also shows the data in the data year for the previous card. So you can check and see what it was the year before on every single county card and also the statewide card if you're interested in knowing how things have changed over time. Sorry about that noise, guys. I'm here with my nephews. The oldest is 3 years old.
Thank you. That was helpful. And now I see the little previous year data point below there. Just was not seeing that at first. So thank you.
No problem.
And folks, if you haven't seen the county data cards yet, I just dropped the link into the chat box, but they're available for all 100 counties. on our website right now. Liz, thanks for that question. Do we have any other questions from members of the press for Whitney? All right. I don't hear any others coming in. Anybody else on the call? I know we have lots of amazing child advocates from around the state also on this call. I want to give you guys a chance to ask questions too. So if you have a question for Whitney, just go ahead and unmute yourself. All right, not hearing more questions coming in. I had a typo in that link. I apologize. Thank you, Kelly, for pointing that out. So ncchild.org/data cards is the link for those county data cards. Last call on questions. Anybody else have a question that they want to ask Whitney before we end the broadcast for today?
Yeah, this is Ross again.
Sure.
I just had a question just because I noticed another metric you guys included was delinquency rates among kids. I believe it was age 16 to 15, I mean 6 to 15 years old. And I noticed that at least here in Iredell County, ours was around 25% compared to the state, which was around it was 25 per, I think, 1,000 versus the state, which was like 16. In light of the NC Raise the Age law, are you guys expecting to see that number increase or decrease?
Sure. So because of Raise the Age, we do think that, first off, that the indicator is going to change slightly, right? So you're going to see that the age range will change in next year's cards, and so it won't compare. I won't put the previous year on there because those numbers won't be, similar figures anymore. But I will say that once we fold in those older children, that delinquency rate will probably increase slightly if you were to compare one year to the next, but that would be an unreasonable comparison to make because you're essentially looking at a different group of children, right? So the first time that you'd really want to make comparisons from one year to the next would be with the 2021 cards, comparing them to the 2022 cards, who would include that older age range of kids. You understand what I'm saying?
Gotcha. It's just a different set of numbers.
Right. It's a completely different set. So like technically the number will be higher, but that's just because it's including more kids. Cool. And that's, likely to be higher. I don't know that, but yeah.
Okay.
If there aren't any other questions, I just want to, remind you guys to really localize as much of your coverage of the county cards as you can. If you are talking about this at, town halls, teletown halls, if you're writing stories about this, to think a lot about the ways that different population groups might be affected differently. So for example, with poverty, because we know that some of those groups that I listed out for you guys are at a higher risk of living in poor and low income homes. Think about whether state and local decision makers are doing what's needed to protect the families of young children. If we're talking about poverty, are there approaches that could be better targeted to Black and Latinx communities? Will rural counties receive what they need to recover at the same rate as urban counties? Rather than talking generally about whether that there are approaches that are meant to decrease poverty overall, because a lot of the time we just don't see that trickle down to the groups that are most negatively impacted. And so really localizing your coverage, I think, brings that attention more to policymakers and reminds them that there need to be special approaches that are taken with groups that have disparate impact.
Great. Any other questions? Last call before we end today's broadcast. All right. Well, I want to say thank you very much to everybody who joined us today, all of the child advocates from across the state who are on this video conference, all the members of the press who joined us. Thank you very much for taking your time out to learn a little bit more about what's going on with kids and families in North Carolina. Hope you'll take some time to dive into these data cards. They are full of information that will help you. We hope will help you in your work going forward. And if you do have any questions, follow up. Whitney's just put her email into the chat box so you can follow up with Whitney. If you want to connect with local child service agencies, we can connect you with folks in your community who are working with kids and families every day and are the real experts in what's happening in their counties. So again, thank you very, very much for being here, and everybody please stay healthy and stay safe.
Bye, everyone.